if there is anybody who is still running a spa and you do not have a license to practice invasive or any medical procedure, please close it before we get to you. Close it today. And we are not saying that people have been restricted from going for plastic surgery. There are many people that deserve actually to go for plastic surgery. Maybe you have extensive burns and all that, you know. But we are saying whoever is running the spas unauthorized must close them. We are not going to allow people to continue dying because of irresponsibility of individuals who are selfish and hungry for money. We must put things straight. Already we have inspected most of these facilities across the country, and we shall continue inspecting them so that we put things straight. And please, when you open a spa to massage people, stop getting invasive in their body. Issue of drugs and substance, which is very, very key in our teaching in our society. There are other products, the novel products that have come into the market, the electric cigars, the issue of pouches, the issue of tobacco use, you know, raw tobacco use. It is important we note that these products that have come and are new in the market are very appetizing. Sometimes the labeling looks very glossy and can be appetizing to even our children. I want to tell the manufacturers and the sellers of all this that we will not allow any products that are not labeled properly, and we will not also allow products like shisha to continue being taken in this country, whether to manufacture, sell, or even market to the people of this country. Because these people who are living TVET, they go and get fond of them, and then they get intertwined into them, and they are not able to continue building their economy the way it is supposed to be. Therefore, let us take care of our families, let us take care of our society, let us take care of our children who are being hoodwinked by products that are packaged in a manner that are so appealing to the people of this country. I want to assure you that the government is not trying. Shisha is banned. So whoever uses shisha is against the law, and the full force of the law will catch up with you. You see, you may be using it in your house, you may be using it in a restaurant, or even in open spaces. So we shall get to you. So really, we cannot say the government is right. We have the shisha is banned in this country. So when you start enjoying it in any facility, please know you're committing a crime. And anytime, the long hand of the law might catch up with you. I'm excited, and especially to see what true transformative leadership means. This is exactly it. When you touch the people at the bottom of the pyramid, by the virtue that every year Kenya has more than a million people who enter the job market without skills, is evident enough that we need these courses being trained to the young people. And again, 35% of our population are between the ages of 15 years and 34 years. These are people, probably they are still in school, or some of them have dropped out of school. So they are in the job market, but they do not have any skills. So I want to congratulate the Member of Parliament, Bahati constituency, for this transformative leadership and for showing the right direction in how things are supposed to be done. I also want to echo that health and vocational training are joined at the hip, because these people, when they train, one, occupational health and safety is one of the key areas that we need to integrate in their learning. At the end of the day, everybody needs to go to work when they are healthy. Therefore, when they know what occupational therapy means, and equally occupational health, safety at the workplace, it is very important. The health literacy, again, education, including the basic health issues that they need to know, even the minor ailments that they may get while they are at their workplace. Again, using safety precautions while they are at their workplace, ensuring that they are wearing their protective gear, whether they are doing electrical work, they are doing construction work, or they are doing hairdressing. It is important. For instance, somebody who is doing chemical, putting chemical in the hair, it is important that they wear gloves, so that, because you do not know what type of chemical could be in that concoction. And again, electric gears to prevent the eyes from protective gears for the eyes, and equally for the ears. Therefore, these are areas that we come in strongly to train these people at who are training TVET courses, so that they are aware of how to take care of themselves. I want to mention something about mental health. Mental health issues is a medical condition, and each and every one of us must know at any given time you might be a culprit. It is important to note that as they go out to their workplaces, it is important to take care of their mental health. And mental health can come from anything: economic issues, relationship issues, societal issues, So it is important they be aware of what they are expecting. But one more thing that it is important to note that public health is part and parcel of us. There are many emerging and re-emerging issues that we are seeing in the society. We already have been having Mpox, and Nakuru has been one of the spotlight areas with more than 10 people who have contracted from Mpox disease. Again, we have our neighboring countries reporting very serious diseases like Marburg. And this is important for us to note how to take care of ourselves. And keeping our spaces clean is one of the key things that we must do. As simple a thing as cleaning our hands. Clean your hands. If you find you are unwell, please stay at home until you are treated. I want to congratulate the community health promoters. These are our foot soldiers on the ground, and their work is evident because their role is moving from household to household. And their work is basically taking blood pressure, checking your blood sugar, ensuring they remind mothers and caregivers on what they need to do, taking their children for vaccination when it is at the right time and the right doses. Ensuring they remind the pregnant women and the pregnant mothers that Linda Mama is there, that they need to go for prenatal and postnatal. And equally, it is going to take care of them during delivery. Therefore, I'm happy with the work that they are doing across the country. Already, 25 million people have been seen and assessed for diabetes. And more than 300,000 people have been referred to a health facility for further assessment. Again, more than 17 million people have come across the community health promoters, and they have been able to assess them for blood sugar. And these are the kind of ailments that are disturbing very many people. And this only shows that they are walking patients in our society. You're sick, but you do not know, because probably you are used to going to a pharmacy and prescribing yourself and taking the drugs. Very soon, that drug is going to be resistant to your body. So we are encouraging all Kenyans that if you see a community health promoter, please allow them to take your blood pressure, check your blood sugar, and when they refer you to the nearest facility, go and get checked by a skilled healthcare professional so that they are able to prescribe you the correct drugs. Otherwise, our AMR is getting higher and higher in Kenya. the drug resistance in our society, because we are used of running to the chemist, running to the pharmacy, prescribing ourselves and buying drugs without proper prescription from the professionals or the medical professionals that have been trained to do that. So thank you very much. Congratulations to the graduates. We are looking forward to see them build the economy even more. I know His Excellency, the President of the Republic of Kenya, has been very keen about skills that these young people are going to gain, because they will help them in future. Instead of being idle in the community, they will come in handy. We are lacking people even to fix our fridges. We are lacking people to fix our bulbs. We lack people even to make even our nails so that they look better when we are going to work. Therefore, kazi ni kazi, and when you get a skill, do it like you have never done it before. I'm talking to you. Asante.